In the spirit of giving to the less privileged and vulnerable persons in the month of Ramadan, the governor of Yobe State, Mai Buni, has launched the distribution of Ramadan palliative to 30,000 vulnerable households across the 17 local government areas of the state. Addressing the beneficiaries and the invited guests, the State Commissioner for Humanitarian Affairs and Disaster Management, Mero Amshi, said the gesture by the state government is to ensure that residents are not left out in the ongoing fast because of lack of food to break daily. She urged the beneficiaries to use the given food items for the benefit of their families.
This initiative is part of our collective commitment to ensuring that no family goes hungry, especially during the blessed month of Ramadan, a time of reflection, sacrifice, and generosity. His Excellency, the Executive Governor of Yobe State, has demonstrated unwavering dedication to the welfare of our people, prioritizing humanitarian support, food security, and resilience building for most of our vulnerable members of our society. The distribution we are launching today is not just about providing food. It is about restoring dignity, strengthening community resilience, and ensuring that families can observe Ramadan with peace of mind. The government understands the challenges faced by our people, particularly those affected by food insecurity due to poor harvest, displacement, economic hardship. Through strategic interventions like this, I would like to express our profound gratitude to our development partners, local and international humanitarian organizations, and all stakeholders who continue to support the government's efforts in addressing humanitarian needs. Your partnership remains invaluable in achieving our shared vision of a food-secured and resilient Yobe State. To our esteemed beneficiaries, we urge you to make the best use of these provisions. This is part of a broader strategy to support household food security and improve the well-being of our communities. Be assured that the government remains committed to implementing sustainable solutions that go beyond immediate relief and promote long-term resilience.
In his remarks, Governor Buni stated that the distribution of the Ramadan food basket to the vulnerable household is an initiative that testifies to the policy of compassion and commitment to the well-being of the people, particularly during the holy month of Ramadan.
This initiative is a testament to the policy of compassion and commitment to the well-being of our people generally, and particularly during this holy month of Ramadan. This in addition to the annual Ramadan feeding centers we have across the state. I'm glad to state that the government is expanding the sum of 297 million to provide food to less privileged persons at the Ramadan feeding centers. Government has also increased the feeding centers from 85 to 102 this year, with additional locations situated mostly in health institutions. Under the Ramadan Food Basket Program, government has procured over 35,000 bags of rice and condiments worth about 2 billion naira for distribution to 30,000 vulnerable households, internally displaced persons, 1,500 teachers and junior staff of the Teaching Service Board, Science and Technical Education Board, 500 resident doctors, flood victims, farmers affected by poor harvest, and other disadvantaged persons in the society.
The governor explained that his administration is determined to ease the burden of insufficient food and provide support for families who are struggling to meet their daily nutritional needs.
Distinguished guests, ladies and gentlemen, Our commitment to the welfare of the people of Yobe State goes beyond seasonal interventions. We have always remained responsive to the plight of our people. In the wake of the devastating 2024 floods, the state government, in strategic partnership with the federal government and the development partners, provided emergency relief including food and non-food items. We equally allocated 1 million naira in emergency support to the most affected local government, 100 million naira in emergency support to the most affected local government areas to provide the much needed relief as we work on more sustainable and long-term approach to help our people rebuild their lives. Today, we are constructing the erosion, flood and water harvesting project in Damaturu and Buni to curb the menace of the floods and harvest the water for irrigation. This will be replicated in other areas of the state with flood challenges. You recall that as part of our administration's continued commitment to resilience and economic empowerment, we launched 2 major initiatives in November last year to restore livelihoods and foster sustainable development across the Yobe State. These are the 1.4 billion naira support for 25,500 flood victims and vulnerable groups who receive 50,000 each, and 1 billion naira empowerment to 10,000 small business owners who receive 100,000 naira each.
Thank you very much. Thank you.
Your Excellency continues to play its role in supporting the most vulnerable members of our society. We all have a collective responsibility to complement the government's efforts to see that your neighbor does not break his fast or go to bed on an empty stomach. We should remain committed to the values of kindness, generosity and solidarity that define us as a people. May Allah subhanahu wa ta'ala bless this initiative and grant us a peaceful and prosperous Ramadan and continue to guide us in our efforts to build a stronger and more inclusive Yobe State. I wish to end my address with a call on those vested with the responsibility of distribution to have the fear of Allah in the distribution exercise to ensure that these interventions reach the intended beneficiaries efficiently and transparently.
Geshwa, a community in Yobe State, is known for its prevalent kidney failure cases. Neighboring communities have had their own fair shares of deaths as a result of the deadly kidney failure. In its efforts to provide solutions, the state government is not relenting to come to their rescue. Now, 50 health experts are deployed to Geshwa town to investigate the root causes.
This is a special intervention project funded by the Yobe State government under the leadership of His Excellency, the Executive Governor of Yobe State, Honorable Buni. And the general idea around it is the fact that we know for probably over a decade now that there is a rising case of kidney disease, especially in the Bade Emirate. 2 years ago, His Excellency visited the United Kingdom, during which we had a meeting with some of the world top scientists working in this area, following which His Excellency now advised me to lead a team that will work both with these local and international scientists to understand the root cause of this problem. And as part of that, we are here in Geshwa with a team of medical doctors, nephrologists, nurses, lab scientists, environmentalists, including chemists, GIS specialists, etc. So it's truly a multidisciplinary endeavor. And to the best of my knowledge, this is the largest state-funded investigation on a single health issue that I've come across in Africa. What do I mean by that? Most health challenges are funded by international organizations. I've never come across a single health challenge that is fully funded by a state government of this magnitude.
It may interest you to know that the Yobe State government, under the able leadership of His Excellency Honorable Memala Buni, has established a dialysis center at the hospital, and then dialysis is being done free of charge for all the indigents of the state. And we've been running this program for the past 8 years, 7 to 8 years, without any interruption, courtesy of His Excellency. So I think we need to appreciate that first. On the average, a majority of our patients are from this emirate. Okay, monthly we do about more than 600 sessions of hemodialysis. When we say sessions, we are not talking about number of patients, but the sessions, one patient can have 2 or 3 sessions in a week, and roughly about half of our patients come from this emirate. So if you look at it, and then we conducted a survey sometimes last year, in which we look at all the hemodialysis center in Yobe, Borno State and Jigawa State at Specialist Hospital Hadejia, and we identified hotspots from where these patients come about. We found out that majority of them come from Bade and Jakusko local government areas of Yobe State.
Guda wajen shida duk sun tafi haka.
Some residents share their experiences with TVC News.
I lost 6 of my family members in the span of less than 2 years, including my father.
Local government or Bade Emirate has got problem of kidney maintenance. We have lost a lot of lives. As I have already said earlier, I myself have already lost about 6 of my blood relation. All of them has undergone dialysis before they lost their life. But by having this, the executive governor of Yobe State, we must appreciate him. We must thank him. We must say a lot on him. It seems he's a leader. He's a leader. We must say he's a leader because he has sent professionals to us. They are now investigating the main problems in the town, and they are doing their work. His Royal Highness, the Emir of Bade, and I myself, we have already sat together and put our head together. We have already discussed, and we are going to give them maximum cooperation to do their work successfully. And they are on the work now, and there is no any problem. We are hoping, we are praying, we are hoping, we are praying to Almighty God that that what they have here to get the problems in our respective local government.
Many residents are now happy with the state government initiatives.
We are very proud. We really and sincerely appreciate the effort of the government.
After the collation of 20,000 samples from the people in Bade and Damaturu local government areas, the team of medical experts are expected to conduct medical interviews to determine whether the causes are environmental, style-related, and generic. Farming is the mainstay of Yobe State. No doubt, Yobe has suffered more food crisis due to conflict occasioned by Boko Haram insurgents.
1, 2, 3.
As a way of providing solutions to the food crisis in the region, officials of the World Food Programme, African Development Bank and MasterCard Foundation visited Yobe State to launch a solar-powered farm in Mamudo community.
What we have behind us is solar production, which is powering irrigation for what is really a centuries-old challenge for fruit and vegetable production here in Mamudu. Now, this is part of the solution to increase productivity, and I'm so delighted here to be with my colleague from the African Development Bank and from MasterCard Foundation, because as you said, we are working together collectively across northern Nigeria. Now, I'm not sure you have your numbers quite right in terms of the collaboration, but what I can tell you is that we're on a mission. We started in Kano on Monday. We were in Jigawa yesterday with the Minister of Agriculture looking at wheat production supported by the African Development Bank. Really impressive, going to scale from the dry season wheat planting. And then we also talked about some MasterCard World Food Program activities up in Bade, in Jigawa. And then today we're coming across to Potiskum. We stopped at the market to see the production potential within the Yobe state, and we're here looking at this project. Tomorrow we're heading towards Maiduguri in Borno State, and MasterCard and WFP will be going all the way to Ngala on the shores of Lake Chad, along with African Development Bank. So we're just going across the region looking at opportunities for co-investment, working also with our government partners, but also engaging with private sector partners for a new approach to humanitarian solutions.
Farming tools were distributed to farmers to ease their work. The efforts are to strengthen food system and promote increased value chain employment opportunity for youths.
We are doing $134 million in all the northern states. So in Jigawa alone, yesterday we were there with the governor and the Minister of Agriculture. We saw a lot of sites that have really made fantastic progress with dry season wheat production. I think the target for all the states, if I'm not mistaken, is around 300,000 hectares, which is going to make a significant dent on addressing the national wheat self-sufficiency, which is a longer-term target. But on this trip, very specifically, it's a learning process. Our colleagues want to understand how we are approaching on the development side. We also want to understand on the humanitarian side so that we can develop an approach that looks at the entire value chain, not only production, but its aggregation, its processing, transportation, but also all the issues of seasonality. Of course, in Potiskum today, we visited the market, as I was saying earlier, and we also spoke to the market people because we are looking at a comprehensive solutions that will go just beyond, looking at vegetable, maize and wheat and so on, that will address the entire food system.
And so this is unique that the three of us come across this region together. And it's showing that we want to do things differently. We want to be more effective with production led by the people of Nigeria, in this case Yobe State, and particularly the youth and women. And I've been so impressed to see the engagement of youth, young farmers in this initiative, as well as so many important women, including women-led enterprises that we just met here in the region.
The officials who carried out the interventions say they are planning for a comprehensive interventions beyond farming in the coming years. The Yobe State Governor Buni has reiterated the willingness of the state government to provide funds to ensure sustainability of the Biomedical Research Training Center at the Yobe State University, Damaturu. The fund will cover equipment, maintenance, and research projects to enable the center to meet the desired international standards. Governor Buni, who was represented by his deputy, Idi Barde Gubana, made the assertion during the opening ceremony of the 14th Conference and General Assembly meeting of the Nigerian Young Academy held at the Yobe State University in Damaturu. The director and founder of the center, Mahmoud Bukamena, who doubles as the special advisor to the governor on research, science and innovation, speaks more about the events.
It's historically considered the birthplace of science innovation. The first stone tools were discovered in Africa, showing that Africans were the pioneers in this area. But yet, Africa is lagging behind. And as a result, we have brain drain. Talented African scientists leaving the African continent, going to the global north in search of better opportunities. And of course, this presents a highly problematic challenge because we need them to solve our local problems. And this is exactly why, with your support and the enabling environment provided by the Yobe State University, we established the Biomedical Science Research and Training Center 3 years ago here in Yobe State. And with all sense of humility and gratitude to Allah subhanahu wa ta'ala, this center has at the moment equipment worth over 2 billion naira. We have some of the best equipment in the entire country, including 2 confocal microscopes, which are only a few in the entire African continent. And of course, Your Excellency, when you launched this center 3 years ago, we made it very clear our mission is bold, which is to train the next generation of African scientists. Make this center open access so that Yobe would become a beacon as well as a scientific hub of excellence within the African nation. And already we have trained over 450 doctors, scientists, and other professionals, not just in Yobe State or in Nigeria, but from Cameroon, Ghana, Egypt, the Gambia, and other parts of Africa.
In his remarks, the State Commissioner for Higher Education, Bello Kawua, described the partnership between the state government and the research center as essential.
Also, is to appreciate the founder of BioRTC, Dr. Mahmoud Bukramaina, for the foresight and the ingenuity in identifying the need to have this unparalleled resource center in our university. At BioRTC Center in Yobe State University leads in cutting-edge research, especially addressing our local medical challenges. We look forward to further partnership with the center to build the capacity of our academics in the state tertiary institutions, especially in science and biomedical research, for our academics to be able to be in tune with the use of AI and the standard modern protocols in science, research, innovation protocols.
I want to assure you that your efforts are not in vain. The work you are doing today, the questions you are asking, and the problems you are solving will resonate far beyond the walls of your institutions and boundaries of this country. They will shape the world for generations to come. For those of us in Yobe State, we are happy that what we are doing within the 4 walls of Yobe State University has gone beyond Yobe State, has gone beyond Nigeria, has gone beyond Africa. We are all over the world. I'm grateful for that. Only 3 years. I'm sure in the next few years, Yobe State University will be a university of recognition across the world. Last week, I was with a group of students at the University of Maiduguri, and they're talking about analysis of their data. And they mentioned Yobe State University, that they have the equipment. Then they quickly said, there's something called BioRTC. I started laughing. I said, this is in my university. Please come.
In his speech, Governor Buni pledged continued support for the university's Biomedical Research Center.
I gladly wish to welcome all our distinguished invited guests, participants, and everyone to this significant event. Earlier, I was made to understand that this meeting is going to dwell on matters relating to biomedical science, research and training center by RTC to achieve appropriate response to the existing and emerging challenges that affect citizens' health and well-being. As we may be all aware, the RTC was conceived by its founder, Dr. Mahmoud Bukramaina, with objective of inducing science, research, and innovations for speeding up growth and development within the state in particular and beyond in general. Therefore, there's no gainsaying that the fact that this common drive of ours is geared towards serving humanity in its entirety. Obviously, our august visitors from across the country and even beyond may have similar belief and equal zeal in promoting knowledge and progress of all people, and this is underscored by their presence in our midst today. Yobe, as a state that was inflicted with over a dozen years of incidency, with devastating consequences on all facets of our lives, needs a deliberate and concerted effort to ensure quick recovery.